Early West Nile virus outbreak in Twin Cities mosquitoes. What you need to know. The alarming rise of the West Nile virus in the Twin Cities has prompted health officials to advise the public to exercise caution. This year, the West Nile virus is appearing in mosquito populations earlier than expected, according to local authorities. The Metropolitan Mosquito Control District, MMCD, has reported that mosquitoes across all 7 counties under its jurisdiction have tested positive for this virus. In fact, the positivity rate for July is notably higher than usual. Approximately 25% of the mosquito pools tested last week were found to be infected with West Nile. This level of infection is typically observed in late August, a time when mosquito populations are usually declining. The species of mosquito that is most commonly responsible for transmitting the virus to humans is currently thriving in numbers that are among the highest recorded by the MMCD. However, it's important to note that this situation does not warrant panic. Alex Carlson from the MMCD reassured the public, stating, "It's not something people need to be afraid of. It's just higher than we've seen in many, many years." So far this year, Minnesota has reported only 1 human case of West Nile virus. Dr. Beth Tyling from M Health Fairview and the University of Minnesota Medical School explained that most infections do not show clinical symptoms, and only a small percentage of individuals develop severe cases of the virus. To protect yourself, officials recommend several preventive measures: using insect repellent, wearing long and loose-fitting light-colored clothing, eliminating any stagnant water around your home, and staying indoors during peak mosquito activity times. The NMCD oversees mosquito control efforts in Hennepin, Carver, Scott, Dakota, Washington, Ramsey, and Anoka counties. As we navigate this situation, it raises an important question. Are we doing enough to protect ourselves from mosquito-borne diseases? What additional steps do you think should be taken? Share your thoughts in the comments below. West Nile virus surges in Twin Cities. What you need to know. Imagine a tiny, almost imperceptible threat lurking in the shadows, waiting to strike when you least expect it. This is the harsh reality of the West Nile virus, which has been surging in the Twin Cities, leaving a trail of concern in its wake. But here's where it gets alarming. The positivity rates in mosquito traps are unusually high, signaling a potentially severe outbreak. The Metropolitan Mosquito Control District, MMCD, has been closely monitoring the situation, and their findings are nothing short of disturbing. As Dr. Scott Larson, MMCD entomologist, notes, the number of Culex tarsalis mosquitoes, the primary species responsible for transmitting West Nile virus to humans in Minnesota, are way up. In fact, recent surveillance efforts have revealed a sharp increase in these mosquitoes, with some traps containing over 100 of them, a truly atypical phenomenon. But what does this mean for the general public? The answer lies in the numbers. Last week alone, the lab processed 187 mosquito pools, with 34 testing positive for West Nile virus, resulting in a positivity rate of more than 25%. As Dr. Jordan Manley, MMCD vector ecologist, points out, this surge has unfortunately been accompanied by a notable increase in WNV detections, with one of the highest positivity rates we have ever seen in July. And this is the part most people miss. West Nile virus has now been detected in every county in the state, making it a widespread concern. The Minnesota Department of Health has confirmed the state's first human case of West Nile virus in 2025. Reported in Dakota County, which has been submitted to the Centers for Disease Control and Prevention. But here's the thing. About 80% of people infected won't even know they have it. So, what can you do to protect yourself? Health officials are urging residents to take precautions, such as wearing insect repellent, eliminating standing water, and avoiding outdoor activity during peak mosquito hours, typically around sunrise and sunset. But the question remains, are these measures enough? The controversy surrounding the effectiveness of these precautions is ongoing, with some arguing that more needs to be done to prevent mosquito-borne illnesses. This is where we want to hear from you. Do you think the current measures are sufficient, or should more be done to combat the spread of West Nile virus? Share your thoughts in the comments below. As we navigate this complex issue, it's essential to consider the potential consequences of inaction. The surge in West Nile virus activity is a stark reminder of the importance of vigilance and proactive measures. By working together and staying informed, we can reduce the risk of infection and create a safer, healthier community for everyone. But the clock is ticking, and the time to act is now. Will you take the necessary precautions to protect yourself and your loved ones, or will you wait until it's too late? The choice is yours, but the consequences of inaction could be devastating.